good morning, everybody. Thank you so much for having me here today. It's really quite a privilege and an honor to be sharing about a topic that I'm very passionate about. Um, and thank you so much for that wonderful introduction, Dr. Dixon. Okay, should I start sharing my screen and we can get started? Okay. Can everybody see that well?
Yes. Absolutely.
Okay. All right. All right, so we're here. I'm going to talk about the rehabilitation of what we know as our modern day marine dinosaurs. Um, we know that birds and reptiles are the descendants of our prehistoric creatures. And so they have adapted throughout the centuries and the millions of years since they first ruled the planet. And they are unfortunately now a lot smaller, but we still want to preserve their existence on this planet as much as we possibly can. So, all of my activities and pictures taken for this presentation were performed at the Loggerhead Marine Life Center down in Juno Beach, Florida, which was authorized under their rehabilitation permit. So, all of these were credentialed activities. So, what it looks like is the Loggerhead Marine Life Center, will get a call um, of a stranding. It could be on the beach, it could be in the water, they could be floating, they could be debilitated in some way. But in any case, there is a turtle in distress. And so when this happens, the first thing that we're going to do when we get that stranding call from the public is get a history. We want to know if the patient is stable. What this means is, are they bleeding out? Do they look like they're in active distress? This will prompt us to know what to prepare and how to react more quickly. We are required by law to notify the associated agencies so that there is documentation that we are picking up wildlife. So in this case, it's the Florida Fish and Wildlife Commission. We have to notify them within 24 hours and then fill out a stranding report, which I will show you guys in the next few slides. Once we go out and we retrieve the sea turtle, we're going to bring him back and do a physical exam. We take some basic measurements, the weight for one. We take the straight and the curved carapace length. So the carapace is the top of their shell, the bottom is the plastron. And we measure that from the notch to notch and then notch to tip. We take photos of their original intake, which documents any epibiota. So you can see in the top right corner, peanut pie was covered in significant amount of algae. And so we're just giving them a little scrub after we take the photos. Then we do a minimum database. So we collect blood and chemistry and we do radiographs just to see what is going on, if there's any infection, um, if they have any buoyancy issues, if they swallowed a foreign body. Foreign bodies are extremely common, especially fish hooks and fishing lines. So it's extremely important that we want to clean up any type of debris because the sea turtles will swallow this and then it can really mess up their GI, mess up their ability to eat and go about daily functions. So this is the sea turtle stranding report form. You just like fill out who documented the report, the location that they were found, circumstances of the encounter. So where were they found? Are they on the shore? Were they floating in the water? Were they floating underwater? Were they trapped in rocks? How were they caught? Or are they nesting related? Do they have any tags from previous stranding reports or any other sea turtle centers that may have documented? And then again, carapace measurements, the species, Juno Beach, Florida specifically gets loggerheads, greens, and leatherbacks. Occasionally, they will see hawksbill sea turtles. We had a hatchling come in, but that's not very common. And then, photos, the conditions, are they alive? Are they dead? Is it a decomposing carcass? Is there any body parts missing? The weight, tail measurements, and then, how are they doing overall? Are they bright alert? Are they quiet and alert? And then they want to know which rehabilitation center they were taken to. So a really important thing is restraint handling with these guys. When they're smaller and they're only a few kilos or like, less than 10 kilos, it's pretty easy to pick them up, but they have very powerful flippers. And if they are, since they are on land, they are in distress. They're not in their natural habitat. So they are going to move them and they can do quite some damage to you and to themselves. There's actually been reports from restraint and handling that they broke their femur just because of how powerful those pectoral muscles are. So we want to have extreme caution when we are handling these creatures. And I will show some pictures in the next few slides. Of how to properly restrain them. Small ones you can usually pick up on the sides of their carapace. Larger turtles, you can grasp at the anterior notch and the posterior notch and help hold them down and press their head onto the ground to help keep them calm. You always want to transport the ones that can be transported in a crate with a towel on top. It reduces the stress and it's safer for them that way. So here in the left side of the screen, we can see Peanut Pie again. And Peanut Pie is being held under the flippers appropriately by one of the interns. And then on the right side, you can see the notch to notch hold as we're giving a sub-Q injection to Dandelion, which is a loggerhead. The left one is a green sea turtle. He's getting sub-Q injections with just fluids. This is Sweet Potato, another adult loggerhead. This was my first day at the Loggerhead Marine Life Center, and they got to release her, which was a public release. So it was a big event, and it was really amazing to be a part of. So again, physical exam, when we bring them in, we want to document their body condition score. We want to identify their age and gender. It's really hard to identify their gender when they're hatchlings and juveniles. So really, we can only do it on the adults. And again, that's species specific. The males, they generally have tails that are longer and extend beyond the carapace, and the females don't have a long tail. It's a very small tail, and generally most species reaches maturity about 30 years old, but this has a lot of variability between all of the species, and we really don't have a lot of documentation with it. So your physical exam is going to be 3 parts. You have your out of the water, you're in the water, and then your hands-on assessment. When you do your body condition score, it's at 1 out of 5. You're going to be looking at the prefemoral space, which is between their neck and their foreflipper. You're going to look at their strap muscles, which is on the dorsum of their neck. You're going to look at the concavity of their eyes, also their plastron. So you can look at them and see, is it flat, is it convex or concave? Because it is, even though it is very hard and made up of keratin, it can expand depending on their coelomic cavity. So it's a good indication of their body condition score. And it's really important to get a good body condition score because we need to know, first of all, the nutritional status. Has that animal been eating consistently in the wild? It helps us determine like how much we need to feed them while they're being rehabilitated. And it also assesses while they're in the rehabilitation center if they are gaining weight consistently. So again, here's some nice photos. You can see it at the bottom left of the screen. The prefemoral, sorry, the prescapular space in the shoulder, the concavity of the plastron, the prefemoral space concavity, strap muscles, and the eyes. And you can also look at the supraoccipital crest on the back of their head, and you can see the varying degrees of the body condition scores. And this is just for a Kemp's-Ridley sea turtle. But the body condition score is universal for all of the sea turtles. So now we're at our out of the water visual assessment. We want to see how their responsiveness is. How do they react to external stimuli, their activity level? Are they lethargic, depressed, dull? Are they very active? Are they trying to escape? Are they moving around? We also want to get a respiratory rate and listen to any sounds, see if there's any pneumonia going on, or or any irregularities. We want to document any external wounds or lesions, anything that's old. So Peanut Pie had an old boat strike lesion in the dorsal cranial aspect of her carapace, so we had to document that, and that goes on the stranding report as well. I forgot to mention that. You can also see Peanut Pie's rear flippers have two unilateral bites out of her flippers. We're not sure. It looks like a fish took a bite out of her. It's pretty uniform on either side. So either she has really bad luck and just got one flipper bit and then the other, or it could be some kind of developmental abnormality, but that is you probably most likely unlikely. We also want to check for any entanglement from fishing gear again, and then the quantity and location of epibiota on the skin and shell. We also, as I said, want to document the mentation. So bright, alert, responsive, quiet, depressed, lethargic. Do they have a head tell? Are they hyperreactive? Or do they have, are they able to lift their head? Because lifting their head is how they breathe because they hold their breath. So they will basically like extend their neck and head out and just open their mouths and then breathe and then um, close their mouths and hold their breath for an extended period of time. So their in-water assessment, a healthy sea turtle should not want to be around you. They are curious creatures, but they are very active and they should try to swim away from you. When we do our in-water assessment, we want to assess the diving capabilities, their buoyancy control. Are they floating up to the top or are they just sinking down to the bottom? How's their vision? Um, are they being able to feed themselves? How's their locomotion, their swimming capability, and are their general attitude in the water? And then again, here's dandelion. So once we finish that, we're gonna do a hands-on assessment. We're gonna palpate the head for any trauma. It is very common to get boat strikes here. We're going to check the eyes for any ulcers. You can see Dr. Barron, she's the head veterinarian at the Loggerhead Marine Life Center. She's performing an ocular exam on a Kemp's Ridley sea turtle. He's non-releasable. And so we were preparing him for transport to another facility. You want to check their ears. So they have an ear scale, which is called a tympani. And they can usually get abnormalities like swellings from oral abscesses or air or fluid secondary to head trauma. Their rampathicae, which is their keratinized beak, it's the covers the maxillary and mandible of the jaw, and it grows continuously throughout their life, but it does not need to be trimmed. When you do an oral exam, we have a bite block, which is basically just a piece of metal with vet wrap wrapped around it, so nobody loses a finger. We just want to check their mucous membranes, see if there's any abrasions, ulcers, plaques, foreign bodies, odors, etc. It is very common to find, excuse me, barnacles inside the loggerhead mouths. It's a form of epibiota. And then you also want to check their cervical region and see if there's any signs of Horner syndrome. Horner syndrome, if you guys forgot, it's meiosis, ptosis, sunken eyelid, and then third eyelid protrusion. And then here is a photo of the Rampothecae for the Chelonia mitis, which is the green sea turtle. So you can see where it extends and stops on their jaw. And then these are also just the different conformations of different species. Chelonia is green sea turtle, Caraqueta's loggerhead, um, Aretmocalius imbricata is the hawksbill, and there's Kemp's Ridley here, Olive Ridley, and I am forgetting this last one right here. And then I think this is actually the Australian flatback sea turtle. Sorry, that's only native to Australia. And then this one down here is the leatherback sea, Dermochellus coracia. So continuing with our hands-on assessment, we want to get a good evaluation of their cardiorespiratory system, and how we monitor their heart rates. Turtles in general, as an overall species, it's hard to get a heart rate, so you have to put Doppler on them to hear it, and so you put it in between their front flipper and their cervical region, and the normal range is 30 to 60 beats per minute at room temperature. Because, and we say at room temperature because these guys are poikilotherms, so that means that they regulate their body temperature based on what the outside temperature is. Their respiratory rate will vary between their activity and temperature. Again, as I said, they can hold their breath for quite a long time, and they don't have a diaphragm. So in adults, it's typically 3 breaths per hour. And so for them to facilitate one respiration, they have the downward movement of their plastron, the upward movement of their carapace, and then that's coordinated by the pectoral and pelvic muscles. And then in doing so, they're extending their neck and opening their mouth to take that inspiration. Skin, we want to assess that as well. As I said before, some very common abnormalities is trauma. So boat strikes is very, very common, unfortunately, with the increased water traffic that we are seeing now. There's entanglement in fishing gear, again, very common. Shark bites, FP is fibropapilloma virus. It's a common virus that causes these gigantic, or it can be a range, but the worst one that I saw was this quite large and gigantic lesion that was essentially inhibiting sea turtles' ability to swim. That one, unfortunately, we had to euthanize. Um, we are looking for any viral or microbial infections, ectoparasites, and again, epibiotes. You can also get traumatic injuries from aggressive mating, dredging, which is when a boat drops a net on the bottom to trawl up things, trawl up fish, clams, anything else. They can get pressure sores from being on land too long, and then other issues. Again, shell, we can get a lot of traumatic injuries, mostly spinal injuries to the caudal carapace is very common, again, with boat strikes. And again, also when you are trying to identify these animals, the number of scutes, which is each individual formation that you see on their shell, varies in appearance and number based on the species. So this is Matcha. She's a green sea turtle, and you can see that she has 4 lateral scutes. And again, you also want to palpate the carapace, make sure it's not soft. They can get shell rot from too much epibiota, and also they might have some underlying metabolic disease that is contributing to the softening of their shell. They can also get osteomyelitis, ulcers, propeller injuries from boat strikes again. are all things that we consider when we're assessing their shell. And as for epibiota, this is very common to see with these animals. You can get over 150 different species from algae, barnacles, sponges, tunicates, corals, anemones, snails, bivalves, crabs, etc. This is Lefty, again, who's the Kemp's Ridley that I was speaking of. He's non-releasable. You can see he's hosting a whole mohawk of algae here, which we sadly had to remove, but he was definitely exhibiting his punk rock vibes before he was transported to his new home. Um, it is theorized that these are an indication of disease, but again, we are still trying to research this, and that the epibiotes grow when the turtle is less active or spends a lot of time on the ocean floor, which could again be indicative of disease, some kind of underlying disease process. So here's Lefty getting a little scrub. You can see he was quite filthy. Sandy, this was a chronic debilitated loggerhead adult that came in. And you can see she's covered in epibiota, barnacles. She also had leeches. Zia, also another chronic debilitated sea turtle who came in with a significant amount of barnacles on her carapace as well. We also want to look at their claws, their appendages, range of motion, muscle tone, atrophy, hypertrophy of either limb. Is there any swelling, crepitus, or deformities? And again, most common injury is traumatic from sharp bites and fishing line entanglements. This fishing line entanglements can become extremely serious. So if you live near the ocean, if you fish in any rivers or lakes or streams or anything, please make sure that you are disposing of this appropriately, because this will ultimately end up back in the ocean. And Dora, and there was another case that I saw, which was quite startling and upsetting. Dora had to have a forelimb amputation because of how constricted the fishing line had wrapped around her limb, and so we had to amputate it in order to make sure that she could continue to live. And then I forget the other case, which I should have pictures of coming up. We can talk about that when we keep going. Again, you kind of you can't really like feel their abdomen like a dog or a cat. So you're going to palpate in the prefemoral space as much as you can to see if there's anything that you can feel, any types of distension. Another issue with animals that are out of the water for too long is cloacal prolapse, or it can also come from intestinal impaction and obstruction, but thankfully, usually this resolves once they go back to the water. Another really important part of our assessment is the neurological exam. We have checked their withdrawal reflex. So basically, just take a pair of hemostats and just pinch their flipper and see if they react. It's indicative of their deep and superficial pain. We also want to note if they have a cloacal clasp reflex. A writing response is if they're placed upside down in the water, do they put themselves back in the right position? If there are any central or forebrain lesions, you should usually see like narrow, tight circling and vestibular. There's wide circling. I did not personally see any of these cases, so I cannot give you any personal experience for that. Here again is dandelion. Yes, we're working with the water, and as I said before, these animals are very strong. They're going to move their flippers because that is their flippers, and their mouths are the main defense. And so you have to be careful of the claws that they have on their front flippers. And yes, you will be getting wet even if you are dry. Nutrition, when they do come in, we usually calculate 3 to 5% of their body weight, and then 1% if they're in good condition, and it's adjusted as needed, usually weekly when we assess. And then we also calculate the resting energy requirements. So quickly, I'm going to just talk about some basic biology. So they are pelagic. Um, they forage in the pelagic and the benthic zone. So the pelagic zone is just open water, and the benthic zone is um, essentially the ground. And so they follow a oceanic noritic developmental pattern. So oceanic is just open ocean, and the noritic zone is up along the coastline. The different species follow different different developmental patterns, but they're generally all the same. And as they go through their different as they go through their different, as they go through their development, where they forage and where they develop will change. So we know that they are hatched on the shores, and then they swim out to the ocean and find refuge in the kelp forests until they are up to maturity to keep their progression going. So species specific diet. So greens are the only green eating sea turtles in the ocean. The loggerheads are your meatheads. Hawksbills are spongivores mainly. Leatherback sea turtles are gelatinivores or obligate jelly consumers. Kemps and olive ridleys are omnivores, and the flatback Australians are mainly soft-bodied invertebrates. So we have a wide range of diets that these guys consume. And these are just a little bit more in detail of the life stage that they are in. Greens actually start out when they're hatchlings as carnivores, but as they mature to become juveniles and adults, they become primarily herbivorous, and this is due to an intestinal microflora change when they move more coastal. And then I listed some examples of the type of organisms that each of these guys consume. And I can also send you guys this PowerPoint if you're interested in more details. So an interesting question that I had was, again, how did the greens change their diet? And oops, as I said before, it is an intestinal microflora change that several studies have uh, assessed, and there's still current ongoing research about what exactly causes it, but it is most likely primarily due to their their change in region as they mature. So nutrition, these are just some basic concepts that we look at when we're evaluating. You have your lipids, your amino acids, minerals, vitamins, water soluble and fat soluble. We really commonly give B12 here, or sorry, at the Loggerhead Marine Life Center. And then also thiamine was also pretty commonly given. So nutritional concerns for your vitamins. You can give vitamin C to help reduce stress. Thiamines for sea turtle for who are fed fish. If you have deficiencies in vitamin A, you can get squamous metaplasia of the conjunctiva. You can get hyperkeratosis, oral abscesses, and swelling and fluid retention. Um, the other ones are really important for immune support and bone development, as you can see. And K is very important in blood clotting, but this is not commonly seen in the sea turtles. Um, Also, other minerals, we have calcium and phosphorus, which is really important for egg laying and post-hatchling growth. They can get nutritional secondary hyperparathyroidism, which results from diets low in calcium or high in phosphorus. And so these are one of the presentations that you can see: a soft, pliable, or deformed shell and skull, pathological fractures, and other things. But there's really not much data on minerals, unfortunately. The different feeding methods that we use, we can free feed them, which basically is just hand tossing food in throughout their enclosure and having them swim around and go get it. It's kind of hard in rehabilitation to really promote that foraging behavior. So we try our best to make them work for their food. In some cases, we do assist and we use tongs. We don't use our hands because we don't want them to have that visual association that a human hand is going to give them food, that will help them survive in the wild. And then if we really can't get them to eat, we will tube feed them. So Matcha was one of the sea turtles who was refusing to eat after a few days, and we did have to tube feed her. And the formula that we feed them depends on the age, weight, and the condition of the sea turtle. After we put the tube in, we want to keep them elevated for 3 minutes so they don't regurgitate or aspirate. And if they do regurgitate, you have to tilt their head down and return into the water because they'll be able to flush that out of their system naturally. Um, blood blood collection. You can get it from 3 different places. The external jugular vein is most common, dorsal caudal coccygeal vein, and the subcarapacial sinus, which is in the bottom left photo. You have to be careful though, because you can get dilution with lymph because these vessels run parallel with each other. And so in the right picture over here, we are getting a jugular vein stick here. And here's just more of the anatomy. And again, here we're actually doing IV parenteral nutrition because this sea turtle, I don't remember who this was because I didn't label it, was really, really quite sick. And so we had to get them straight up nutrition into their veins to help try to get their bodies back to functioning to normal. Let's see. Blood transfusions do occur, especially when the patient has an extreme anemia, a PCV of less than 25. The patients that I saw when I was there that came in on emergency, some had a PCV of 7. So what we usually do is you get the donor is the same species. You want to make sure that they have a healthy PCV and you can safely remove 1% of their body weight in blood. And so we do a quick cross match to test the compatibility of the donor's blood with the recipient's. And we just want to make sure that they're not going to have a reaction. Typically, though, the first transfer you're safe, but future transfers you have to be more cautious of. And if a recipient can receive up to 3% of their body weight in blood from a donor. So when we also intake them, we want to do radiographs, as I said, as part of our minimum database. Again, this checks for eggs, any foreign objects like hooks mainly and fishing line, evaluates if there's any broken bones or anything else. We usually will do a dorsal ventral, which is in the top right corner. We'll do a lateral. You can see the positioning down in the lower left, and then an anterior and posterior, which is in the top left corner. And the issues with this is that Epibiota specifically barnacles, and I had a really good picture for one of the patients that came in. Their carapace was just completely lined with barnacles. You couldn't see anything at all. For analgesia and anesthesia, we have limited information because they can perform intercardiac shunting, which affects the uptake of the anesthetic gas. Their pain expression is a lot more subtle, so you really have to pay attention to their behaviors. They're more painful or not feeling as well. They'll be less mobile, not eating, hiding in quiet locations, and performing evasive responses. The opioid drug of choice is morphine and hydromorphone. It can definitely cause respiratory depression, which is more significant in Chelonians. So that's something that we have to keep an eye out for. Chronic pain, we use tramadol. And then the most commonly used NSAIDs NSAID is meloxicam. The NSAID preferred for loggerheads is ketoprofen. And again, all of these medications is very limited information. We really don't understand how they their receptors work in their uptake, and everything we know is based off of small animal medicine. Alpha 2s like Dexmed and medetomidine are commonly used for wound debridements. When you get a sea turtle in for wound management, all of the wounds are considered contaminated. So you can get different bacteria as listed. And since this is funding based, you just consider like the cost, the frequency of application, temperament. How are you able to reasonably clean and debride the wounds? There was one patient, Taylor, as you can see in the top right, she had a significant boat strike injury, and it was completely full of mud and grossness. And so they were able to use a negative pressure wound therapy technique on her, which creates a sealed negative pressure bandage around the wound and just basically removes any contamination and keeps that wound clean and allows it to start creating granulation tissue and healing. And again, so here's just a quick overview of the healing process. I'm going to keep moving here because we still have some slides to go. Surgery, again, this is Joey. This is the case that I was telling you about before. This fishing line had wrapped around his forelimb, um, but it had not gone and far enough cranial to leave tissue stump and had been there for so long that what we're looking at right now is the exposed end of his left humerus. So this fishing line cut down the tissue all the way down to bone. Obviously, his flipper was decayed away for who knows how long. But this is a really serious thing that happens with these animals, and it is really, really important. I cannot emphasize enough to please properly dispose of your fishing line and your fishing gear because this is what happens. On top of this, this animal could not swim normally because of the fishing line was entangled on a oyster shell here too. So that's again affecting their ability to survive in the wild and hunt and forage. And so again, like I said, most common cause of death in sea turtles is in the ingestion of fish lines and hooks. I saw several cases, as you can see down here. We had 5 cases, and all of them were thankfully released. I don't know what happened with Joey's case specifically. When I left, he was still being rehabilitated. Again, different surgical approaches to get entrance into the coelomic cavity is the right prefemoral space in the red line, the left femoral, and the ventral cervical. Thankfully for Joey, which he did have surgery, he we didn't have to go into the coelomic cavity. We were just had to go in and remove that humerus completely. But the nice thing about his case was that his body had created a very um, nice granulation tissue. And so it really didn't go much further past than the humerus. Again, here's Matra, and this was the fibropapilloma case that we unfortunately had to euthanize. As you can see, these fibropapilloma warts, lesions can get extremely large and out of control. They will grow everywhere and anywhere on the sea turtle, and they are, I'm sure, quite painful. This is one of our patients who came on an emergency, who's on the anesthesia machine, and we're manually ventilating them. This is some more wound care. This was a resident, forgot her name, unfortunately, because I didn't put it in the picture, but she was non-releasable. And so what you see here is a weight glued onto the back of her carapace because she has buoyancy control. Actually, I believe this is Taylor, but I'm not 100% sure. And so she was having some posterior shell rot, and so we were just debriding it. It was cultured and it came back with Vibrio, and so we are just adding some um, this cream. I can't remember what it's called, but it's a holistic cream that actually worked really well for the shell healing. And we're just putting it on the back of her her carapace there. This is just a picture of what it looks like to have a sea turtle under anesthesia. So you can see the Doppler's hooked up. We want to provide adequate heat because again, these guys are poikilotherms, so they cannot regulate their body temperature as well. So if they get cold, they will be cold, and we don't want them um, to drop too low. Again, euthanasia is always something that is part of the veterinary profession. When we do this, we just can do an external jugular, subcarapacial sinus, or intracelomic if their blood pressure is too low, and an IV is unavailable. And so indications for this is severe trauma, severing the spinal cord, head trauma, or evisceration, or any condition where they continue to decline and they are not showing any improvement or in a lot of pain. So some common medical problems, we have buoyancy disorders. Again, you can have positive and negative buoyancy. There's a theory that if there's too many barnacles that they can be weighed down, but again, it's very rare to have negative buoyancy. Usually you can get positive buoyancy issues. So we can see one of our patients here is got a bubble butt and is floating up towards the surface. You can see she's kind of like lifted on the bottom as well. And in the water here, this is not a normal position for a sea turtle to be swimming with. Parasites, again, barnacles, leeches, they can get spiny-headed worms, nematodes, trematodes, protozoans. These photos are samples from Zia. So she had quite a few parasites. She had Lophostophis, Sulcaris sulcata. These are all different types of sea turtle, trematodes, and nematodes. Another common thing that we see in at the hospital at the Lager Marine Life Center is debilitated sea turtle syndrome. So basically, we don't really know what it causes this. There's a theory that it's due to end stage starvation, any underlying disease that's preventing nutrition uptake and absorption. It seems to be a little bit more common in females. So we're not sure if becoming gravid has anything to do with it, which makes sense because they are putting a lot of nutrients into developing these shells. So characteristics of it is they're extremely lethargic, heavy epibiota coverage, and very emaciated. We had couple, actually three cases come in that I recall. Zia is this one right up here, and this what we're doing here on the right is dry docking. So they're just in a tub with wet towels and sometimes a heat lamp, depending. And we're just observing them overnight because they're just too lethargic and too sick to be in this tank, and they could actually, they're not strong enough to breathe on their own. So for Zia, we wanted to provide nutritional support. So we did total parental nutrition, which is IV, and that includes a lipid and carbohydrate formula that is specifically tailored toward them. This process for rehabilitating debilitated sea turtles is about 4 to 6 months. So it's a very, very long, and usually they come in extremely anemic. So here's a couple, Sandy and Zia. Sandy came in with a PCV of 8, and Zia came in with a PCV of 3. Both received blood transfusions from flaps, and both got total parental nutrition IV, which again, it's a combination of lipids, carbohydrates, and proteins. And then we put them in a freshwater pool for 24 hours because they will cloacal suck, and that's another way that they can become rehydrated. So again, here's Zia, again, very, very sick. We had cleaned off some of her barnacles. Her carapace is falling apart. This patch right here is actually exposed bone. Here she's being dry docked and she's getting a blood transfusion. We're monitoring her temperature, making sure that there's no initial reactions. I believe I am Still pretty good on time. This is Sandy. Again, we're giving her some fluids. And so this is just in her outside tank. She's another chronic debilitated sea turtle. And we're also preparing for some IV parenteral nutrition here. Cold stunning can occur with these guys. So it's more can be acute or chronic, and these occur in the lower latitudes, especially during very cold weather. And it usually lasts 2 weeks, and it happens in large numbers. In chronic ones, it can happen more in the northern region of the United States, in the fall seasons, and it lasts longer than 2 weeks. And they get just very severely bradycardic, bradyapneic, and they start getting plastron bruising. I did not see these while I was working at the center. Hatchlings is a wonderful part of being working with sea turtles, of course. We definitely want to put out as many guys as we can, because out of a clutch of 100, maybe only 2 or 3 of those guys will make it to full maturity. So people will find these guys stranded, stragglers from nests from hatching overnight. And so we bring them in and we test their swim capabilities. If they're not doing right or they're failing to thrive, we'll weigh them, give them some antibiotics, administer some sub-Q fluids, and then monitor overnight. Unfortunately, usually if they're not doing right, um, they don't live very long. I think only a few of the ones that we had, and we had quite a few come in, only a few of the ones that we had come in actually got released. Um, and so the research team will release these guys at night. And so, as you can imagine, life is really hard as a hatchling when your cell is soft and you're really small. So lots of things want to eat you on land and in the ocean. So please be conscientious of when you're on the beach and you see one of these guys. I don't know if there are sea turtle rehabilitation centers in India. But if you find one, please bring them into them, and they can hopefully provide the best care possible for them. In America, we have issues with dogs digging up nests, so it's really important that we are controlling our pets. So this was a really interesting case, which is extremely rare. We actually had a live two-headed loggerhead hatchling come in. It has been documented in reptiles, and it's more common in oviparous Ridleys. It's very rare to see one actually hatch from a clutch. And Justin, the head researcher, he's seen about 10 and 15 years. So very rare. It's a birth defect, and the twins don't fully slit, and unfortunately, they don't live very long. This case was euthanized because of that, which kind of was disappointed. I was hoping that we would give him a little bit of a chance to see how long they might live. But again, these guys generally don't live very long, and I believe that's also documented in mammals as well. So release criteria, which is really exciting. After we've gone through all of the treatments and therapies to keep these guys alive, we want to make sure the head vet has a final physical exam and says that they're good to go, that they're stable. They've been actively eating, drinking, swimming, urinating, defecating, diving appropriately. They've finished their full antibiotic course, which is a minimum of 14 days, depending on the condition that we're treating them for. They're able to hold its limbs and head above water, and they have normal blood work and are disease free. Amputees, I didn't really have a lot of photos for that, but amputees, the minimum releasable number of appendages that they need to have is 2 diagonal ones. So you could have a right front and a left rear, or a left front and a right rear. You cannot release total front or hind limb amputees at all, or Lefty, who was the Kemp's Ridley I showed you earlier, he had free amputated, partial amputation of his limbs, so he was not releasable. So cool thing about release is once we're releasing them, we double tag the front flippers, second scale from the shoulder joint, which increases the chances of the turtle keeping its ID. These things do fall off. We microchip them with a pit tag, which is passive integrated transponder. Take some final measurements to see if they've changed in size, because as again, they can stay quite a long time in the hospital. And then these are just some pictures of the interns loading up the crates with sea turtles to go release them at the beach. And these guys usually get all released close to where they've been found if possible. And if not, if they've been found in the ocean, we just pick random locations along the beachfront. So that is all that I have. These are just some references that I used to create this presentation. And thank you guys so much for joining me today. I hope you found this session really informative and helpful. I think now we are ready for questions if there are any. I will check chat, which I don't see any so far. So, if Dr. Dixon, are you still there?
Yeah, I am here. I'm just waiting for people to ask questions.
Okay.
Uh, Recording will be uploaded in the YouTube, our YouTube channel.
Okay.
Okay, not much questions are there. Something is coming up. Treatment of eye for eye infection and eye discharge.
For eye infections, we use just triple antibiotic for the cases. Um, we didn't have any eye infections when I was on. We did have a corneal ulcer, but we just gave them gentamicin eye drops, and I believe also ofloxacin for that, which is an NSAID. That is a really great question, actually, about the blood donors. I do not know that. We did this twice, um, and I don't, I don't believe that we honestly know much about blood donor groups. There's a lot when I was reviewing the literature, there's a lot that we don't know and just don't understand about sea turtles. But that is a really great question. Um, Artificial insemination. Uh, I I don't believe because these are wild species, we don't want to interfere. They are endangered. So as far as I know, at least at this facility where I was at, we do not do that. I don't think that we that is performed at any rehabilitation center just because it is a wildlife species. Um, we're just mainly trying to protect them, keep them healthy, put them back, and let them reproduce as they naturally would. believe that there has been some attempts to put orthopedic plates and pins into sea turtle limbs. But because of the accessibility, it has not been very successful. And also the fact that when we put them out in wildlife, we don't want to be interfering with them. We have not, and as far as I know, there hasn't been anything on prosthetic limbs,
హలో
but I'm not fully.
లక్ష్మి చెప్పు
I think somebody's
ఏమన్నావు
microphone is not muted. If you could please
అవునా
mute
ఓ
your
పని చేద్దాం
microphone.
వాళ్ళిద్దరు ఉంటారు కదా సినిమాకి ఏమన్నా వెళ్ళింది
Um,
సరేలే నేను ఎగ్జాక్ట్లీ 15 minutes
but
తర్వాత
yes,
హోటల్
sorry.
దగ్గర ఉంటా
I will
మళ్ళీ
try to
ఒకసారి కాల్
answer this
చేస్తాను సరేనా
best I can.
అదే 15-20 minutes
There
తర్వాత
aren't
చేస్తాను
any
ఓకే
prosthetic limbs that I'm aware of at this
ఉంటే
time.
ఒకేసారి
Thank
చెప్పేస్తాను
you.
Sorry for that. Somebody is talking, and
Yes. Thank you.
okay. I think that we have come to the end of the webinar.
Well, thank you guys so much for this amazing opportunity. I am really, really passionate about my work with the sea turtles. So I'm really glad that I got to share it with you guys. Um, I can send you I can send the PowerPoint to um, I can send this PowerPoint to Dr. Dixon, and then you guys can look through all of the information. I have some things in the notes as well underneath the slides that you guys can read about if you feel so inclined to do so. But yes, you can definitely have for examinations what we can perform for pneumonia and treatment. I believe in that case, I don't remember us having any pneumonia cases, but it would most likely be antibiotics. I didn't see any of those cases, so I can't really attest to that, but it would most likely be antibiotics. Yes. So the book that I used is let's see, it is let me hold on, find it really quick. Okay, so this is the most comprehensive book, and I will insert this into the chat if you guys want. It is quite expensive. I don't know if you can get it on like a journal website or through university for cheaper. But this is the book that is the comprehensive of sea turtle medicine and what we know about it. Is an amazing, oh yes, it was this first one by Charles A. Manire. Really amazing book. That's where all my information came up from. I wish I could have uh, added more in detail when I made this presentation, which I presented it to the volunteers as an education panel for the volunteers there. So yeah. But mainly also for the examinations for pneumonia, we would probably once we do radiographs, we would just treat with antibiotics from there. And then most likely, I would believe that we would put them dry docked for at least a couple days to make sure that they could eat. And the concern would be if there's significant pneumonia that they would not be able to dive. That is unfortunate. I don't know. There's actually one of my references. Let me see if I can find it really quickly. It's a free handbook online. And it's also a website. And there's references in my presentation that have some of these listed out that have more that you can like Google. But there is let's see, sea turtle strength. Just trying to find this really quickly. Okay, yeah. I don't know if this is going to go through. Um, okay, yeah. So this one is a free manual, and this is really actually a great website resource to have. So I'll put this in the chat. And again, these are going to be these are will be in my presentation as well when I send that to Dr. Dixon, so you guys can have access to these. Another really great resource, if you do, and I know Dr. Dixon had mentioned this to me before, was you guys have terrestrial turtles. Unfortunately, I don't have a lot of experience with them, but hopefully this is accessible to you guys. This place called Labifer Vet. You can sign up, I believe it's free, and it gives you more information about exotics, avian, reptile, amphibian, and those smaller exotic mammal species that you guys can reference. And this is really, really helpful when you are dealing with exotics.